program with a video. But there are a few seats left, and for those who are in standing room only, you know it's a good event when you're standing at the back of the room to be in the room. So thank you, everyone, for joining us, and let's get it started.
All right, good morning. Is this exciting? Standing room only. That doesn't happen often, right? So we've got some great people. I'm supposed to start off with a few words, but I see some real special dignitaries in the front that I want to call out real quick. But I hope you like the video. I mean, the video, one, it's organic. We do that ourselves. We do it in-house at these two great systems. But part of our new role is working together. And you can see the slogan, Better Together. So we're excited that all of you would be here to support something so powerful, right? A continuum of health, better health care for all of us. But as I look at our front row, I'm going to give a shout out to our Board of Commissioners who made this possible. But I'd like to share a quick story. And Nan Rich, our former senator, former House member, former mayor, current commissioner. She is truly, truly a rock star. This was her vision many, many moons ago. And so for some fun stats, Melita Kitty over here, who has been with Memorial for many years, now with Broward Health. So Memorial, under the leadership of great people like Melita and Tim Curtin, really made a difference for the county decades ago. The goal was to make sure that they provided primary care, to make sure that they had a safety net or an ability that all people were able to be seen. So the vision was realized by the Memorial Healthcare System. Broward Health had hoped to do that and emulate a lot of the programs that Memorial had done so successfully for so many years. And as time went on, they tried to do that, but unfortunately, these two great organizations really worked as silos. And over the last year, we were able to recruit Melita to come over to Broward Health, and as that became possible, the two boards of commissioners of the North Broward Hospital District and the South Broward Hospital District, who I'll introduce later, actually started to hold joint committee meetings, and it was their desire that the two organizations work more collaboratively. I remember Senator Rich would tell us, why aren't you working together? Why aren't you doing things for the entire community? You share the same mission, you share the same values, and today is that culmination about that collaboration, being more congenial, working together to do great things. So it's my pleasure to share a few more things with everybody today, but I wanted to just give a quick shout out also to Monica Sapiro, Kim Campbell, for really all that you do for the county. To have your elected officials, right? Commissioner Hazel Rogers, who constantly is calling me and making sure that we have more health care for everyone. She says, better health care, Mr. Strum. But Monica and Kim, you do remarkable things day in and day out, and it speaks volumes that you would be here today to support this initiative. What most people don't know is it's not an initiative of Memorial, it's not an initiative of Broward Health or the county. It's the three of us working together to provide these incredible services. So I'm going to share a few things that they wanted me to talk to you about, but you saw a lot of the statistics and facts of the gaps or deficiencies that are occurring in our own county here. And so we've tasked Melita, who is now an executive at Broward Health and for the last year, to really help us pull these together. And with the Board of Commissioners of the North and the South, we're now here to share some of those statistics with you. In fact, so I wanted to share a few things just because it's important. One, I'm Shane Strum. I'm the CEO of the Broward Healthcare System. I'm also the interim CEO for the Memorial Healthcare System. And this is really the first of its kind to be done anywhere. It's not done in other counties. It's not done anywhere that we know of, but we're really bringing together two phenomenal systems. You know, the video, I think, kind of told you everything, but the real key points of that are really creating better access to care for all of the residents of Broward County. I mean, what's kind of, and we hear it from Alita, we hear it from our Board of Commissioners, what's frustrating and unacceptable is despite the independent best efforts of both organizations to create and have all this care, Broward Health and Memorial still have some deficits in these areas, but together we're going to erase those. Those that remain will go away. So what we started to talk about as a team and as a board is we said, like when you're thinking and brainstorming, you say, hey, what if? And we said, what if we looked at healthcare through a collective lens? A collective lens rather than through our own individual viewpoints that have happened for so long. So we started to think, how much change could we evoke? What would it look like if we brought everybody together? What if we worked as true partners? So the historical silos are starting to come together for a continuum of health for all of Broward County. So I don't know if there's a slide up there, but you see that the new slogan there, Better Together, with the Memorial Healthcare System and Broward Health. I'm going to touch on some other people in a few minutes, but I see our Board of Commissioners, the one that actually drove this, pushed for it, and had the joint meetings. I'll ask them to stand briefly, but Commissioner Laura Miller of the South Broward Hospital District. The Treasurer, Commissioner Doug Harrison. The Vice Chair of the South Broward Hospital District, Mr. Stephen Harvey. And the Chairwoman of the South Broward Hospital District, Elizabeth Justin. And then we have our Chair, Christopher Pernicano of the North Broward Hospital District. Chair, immediate past Chair, Commissioner Ainger. Our rock star, Commissioner Stamper. And a person, and really these four have worked incredibly hard together at the North Broward. You all at the South Broward have a storied, wonderful history. We've had some ups and downs, but the last 4 years they have paved the way to a new day for Broward Health. And one of the real leaders in that effort has been Commissioner Ray Berry. And then because we have such a great audience, I am going to ask our county administrator, our deputy county administrator, Senator Nanrich, Commissioner Hazelrod, please rise. All right. They deserve the recognition. Getting this many people in a room, I mean, when you look at the elected officials that we have here today, it's pretty phenomenal. It's hard to get this many people under one roof who care about some of these key things that we care about. One thing that we say a lot, and Commissioner Berry was just leading a group at the workshop, a panel, and I see Aurelio Fernandez, the former CEO of the Memorial Healthcare System. We brought him over to Broward Health. Aurelio, thank you for being here today. A true steward of healthcare, but all these folks here today, but bringing everyone in is truly made a difference for all of us. So what we wanted to talk about is the traditional healthcare delivery model changes, so we're launching into new collaboration with the slogan Better Together. It's really through the partnership and determination that we're going to revolutionize really primary care and maternal care, which you'll learn more from Alita soon, for our entire community. But first, it's important to recognize that we couldn't do this without everybody in the audience. I can't name everyone, but the horsepower, the physicians, the clinicians, the community leaders, and the others that are here. I have a few folks here that I want to take a moment to also thank. Special thanks to Denise Grant, the mayor here of Lauderhill. This is a beautiful place. I mean, we're lucky to have something so beautiful. And we have a lot of others who are advocating on our behalf. So some of our other partners, and I saw them a little bit earlier, but I want to make sure we give them a shout out. It was Kathleen Cannon can't be here, but the United Way has several other folks here. Thank you to the United Way. Jessica Lerner of the Community Care Plan. I saw Lauren Chant. Is she still here? The Health Foundation of South Florida. There she is. Now, I'll tell you a great story. As we started to put the partnerships together, she and her organization were generous to give us $850,000 for maternal care, and we opened up the first clinic in Broward. There are parts of Broward County that are health deserts and maternity deserts, and in one of those there were 0 OBGYNs, and with your generosity, we were able to create, with CCP and Broward Health, a new maternity center. We thought we would be lucky if we saw 70 women a day. I mean, 70 women a month. So far, we've seen, what was the number, Melita? Over 2,000 mothers have already been seen. That's unbelievable. And when that partnership worked out, that's when we decided we could do this. Think about it, 70 a month or so to end up with over 2,000. These are mothers that didn't have an OBGYN, they didn't have a primary care physician, most lacked transportation, or a bigger thing was a babysitter or someone to watch the children. So inside this new facility is a daycare. So the moms could bring the children, they're watched while they then go and meet with their primary care physician or their OBGYN at the center. That was really the impetus. When we saw that we could make that much of an impactful difference, the Board of Commissioners of both districts said, let's start to work on this. Let's make it happen a little bit quicker. And so here we are today, but we're pulling in all of our other community providers so we have a shared purpose and a shared mission. So thank you. All right, so I have a couple of other things they always like me to talk about, but I'm going to kind of dispense on some of those things. We have some really phenomenal people who have led the way, who have helped make a big difference. I'm just excited when I look around the room and I see it's wall to wall with people, with really not only our elected officials that make it happen, our commissioners that continue to drive the vision and mission of both healthcare systems, but all of you are big community leaders who make it happen. I just spotted Jennifer Anderson. Thank you for what you do. You want to talk about an organization that's making an impact. I think your organization today is over $200 million. $300 million? Oh my, you should find her after the meeting and immediately hit her up. I'm seeing Tracy Kalari, the city commissioner at Hollywood, but also a registered nurse at the Memorial Healthcare System. Thank you for being here today. From Miramar. So we have a lot. I'd call you all, but one, just that you're here with us today means the world. So it's my honor and privilege. I'm going to ask two more people to come on up here and share their vision, kind of what we're doing. But the chairman of the North Broward Hospital District, Chris Pernicano, the chairwoman of the South Broward Hospital District, Elizabeth Justin. Thank you both. Come on up.
I did. Thank you, Shane. What a great start to today's program. Let me tell you a little story. For some time, the North and South Broward Hospital Districts Board of Commissioners have wanted to explore ways that our health systems could collaborate. While there were several joint meetings between our two boards and a few ideas that stemmed from those meetings, we never really grasped a strong enough vision to fully execute. But that all changed several months ago when Shane became the CEO of not only Broward Health, but also the Memorial System. And in true Shane supersonic fashion, within a few short weeks, he came to us with his first idea of how we could collaborate. When I say that line, I think of Shane in a superhero's outfit with a blue cape. Still nameless and at a high level, Shane knew that there had to be a better way for the two healthcare systems to affect change in the two pillars of healthcare, primary care and maternity care. But he also had a secret weapon, Melita Hakiti. Now think of Shane and Melita standing side by side in superhero outfits. Shane in blue, Melita sometimes in blue, sometimes in red. I don't think there's anyone in this room who doesn't know Melita and her passion for evoking change in healthcare. And now, here we stand, months later, with a plan and amazing partners in place to breathe life into the change, into the idea that is a change to the face of healthcare across Broward County. In a few moments, you'll get to all the better together details from Melita. But I want to thank her and Shane for creating the once-in-a-lifetime opportunity for healthcare in Broward County. And certainly I must give huge thanks to our boards of commissioners, both from the Broward and Memorial side. You didn't flinch at the investment and the time and resources to get better together, make better together a reality. You encouraged Shane and Melita to work together to make it real. You made calls, brought ideas, and so much energy to the table. Thank you for enabling our systems to make a lasting impact on the health and wellness of Broward County. And now, I'd like to introduce the chair of the South Broward District Board of Commissioners, Elizabeth Justin. Chair Justin.
Thank you, Chris. It's a great moment to be here together, both with the North and the South. Memorial's been around 76 years, and Broward Health's been together with Broward for 87. I noticed that we have Broward Health usually put in before Memorial. I asked Shane about it. He said it was alphabetical. I obviously said It's age before beauty. I echo Chris' sentiments about thanking our two boards again. Without them, we couldn't have done this together. For years, like you said, we've been talking about it, and this moment has finally come to fruition. We found a way to impact the health of our community beyond our four walls of each of the hospitals. As safety net systems, Memorial and Broward Health provide care to patients regardless of their ability to pay. So when we continued deficits across our community and in our health assessments, it was not only frustrating, but it was very disappointing. So our physicians and our caregivers are very intentional working with the community, and they understand the value that we bring to each of our communities. But despite our best efforts, sometimes there's additional opportunities that we can imagine. With Shane's recognition of primary and maternal medicine shortcomings, this was that moment. So thanks to everyone in this room, we are embracing the opportunity that exists and boldly moving forward. We have no time to waste, as each day is critical for an expectant mom or a patient whose hypertension or diabetes remains unmanaged. But I think it's also important to share that this is only the start. We are looking at many other ways Better Together can grow, and also how our two health systems can continue to work together. Because of Chair Purakana shared, we understand the collaboration can revolutionize healthcare in our community and in Broward. Thank you all for who have gotten us to this moment, and I look forward to what our future holds. And to keep our program going, please welcome our longtime healthcare advocate, Broward County Commissioner Nan Rich.
Thank you so much. I truly want to thank Shane and Melita for asking me to participate today. It's very important to me, and I really, I've known you all for as long as I've been in the political world and even before, so what's happening here is a dream that I imagined when I first got to the legislature in 2000, so think how long ago that is already. But I appreciate the opportunity to just say a few words. I have to say that the words "better together" really should be prominently displayed, and they are, because they are at the top. If I am not mistaken, this is the first time that the North and South Broward districts are collaborating on an initiative like this. And I hope it's the first of many before an ultimate goal. Which I'm going to state right now. It's okay. Sorry. During my year as mayor of Broward County, you know we rotate. I chose the theme Community Collaboration, Achieving More Together, in recognition of the fact that Broward County in so many areas does work together. When I was listening to the people that were introduced from both Memorial and Broward Health, and from other community partners like United Way, just raise your hand if you're involved with either the community, the CCB, the Coordinating Council of Broward, or the Broward Behavioral Health Coordinating Council. Okay, so I see Cindy and Monica in the back. So we already do this in some places, and it works, and we know that it works. So I'm really excited that it's going to happen here. In 2019, when Broward County received the Culture of Health Prize from the Robert Wood Johnson Foundation, they referred to Broward County as Collaboration County for the same reasons. Today's initiative is a perfect example of the kind of community collaboration that can make such a difference in the lives of our residents. You have already just heard what happened with the maternal health initiative. I went there, I know, right after it opened, and I was just so impressed with it. And people were just beginning to come, and the child care center was open. And now to hear that 2,000 women have already gone through it is incredible. I want to just applaud both Broward Health and Memorial Healthcare for taking this opportunity to work together to care for and improve the health care outcomes for our residents. I have had the privilege of working with both Shane and Melita for many years, as I mentioned, both at the county and the state level, as a state rep, as a state senator, and now as a county commissioner. They both were executives with my Memorial at one time, and now they are both executives with Broward Health. That should say enough right there. So now in Melita's new role, coming over from Memorial, she is enhancing community services. That's what she does. And she brings to our two healthcare systems this collaboration of projects that will enhance healthcare across South Florida. As Shane mentioned, nobody else is doing what we're doing. So we can set an example for the entire state of Florida. Melita has a record of success, and we in Broward are the beneficiaries of her vision. She is so passionate about serving the community, and I just know that we're going to be successful with her in her current role and working on this project and then many after. So again, I just want to thank everyone here. I know you're all involved in one way or another, but we are Collaboration County, and we are better together. Thank you.
In Broward County, tens of thousands of people are not getting the health care they so desperately need. Mothers are without access to critical pre- and postnatal care. Some of our neighbors are struggling with high blood pressure and other morbidities. Some don't have a primary care doctor or access to basic health care. This is our community.
In Broward County, what we see is an increase in high blood pressure and diabetes.
If left untreated, these health conditions can lead to heart disease and stroke, which are leading causes for death in Broward County.
For moms like Patrina Lewis, getting to her maternal health appointments can be difficult. With kids to care for at home, a 40-minute drive to the closest maternity care center was near impossible.
It was just a little bit out of the way for me.
She's one of many with similar stories. But now, we're better together. In a first-of-its-kind collaboration, Broward Health and Memorial Healthcare System are teaming up to make healthcare accessible for so many more.
We know through countless studies that the more primary care doctors you add to a community, actually the higher the life expectancy.
Memorial primary care patient Nick Reynolds says his doctor is the reason he's living a better life today.
It was my primary care physician who connected me with a cardiologist that was able to solve an ongoing issue I was having, struggling with low blood pressure.
Whether it's because of a lack of food resources or transportation to the nearest doctor's office, or simply the inability to afford health care, for thousands, it's an uphill battle.
Our goal is to remove those barriers and to contribute to reduce these health disparities to increase access for everyone.
Through Better Together, we're making sure all residents get the care they need when and where they need it. For Patrina, this meant a maternal health center closer to home.
It's so much easier. Come in here, all the doctors and the nurses, they're very welcoming. They make sure that you're well taken care of.
For Nick, continuity of care even better than before.
I just think it's great that we have two health systems willing to work together to better the lives of the patients in both districts.
We are one Broward County. Better Together will help to elevate the health of our entire community, the community that we all live in, that we raise our families in, and that we grow old together in.
Imagine Broward County, healthier, happier, stronger, better. That journey starts now. Today, we are better together.
don't know how to sing, so I'm not going to sing the song. So, we are here. My God, this is beautiful. These are real people. These are real people that we are helping, that we are making a difference in their life. I just cannot thank enough each one of you for making this real. It is my honor and my privilege to be able to help all of us pave the way. And by the way, my name is Melida Kitty, for those that just saw a woman come up and start talking. And I am the corporate, Shane gave me that title, by the way, Corporate Transformation Executive, because he wanted me to transform things. We have heard our speakers. They have shared all of the exciting news. My job today is to tell you how we're going to be doing it. Two organizations with the resources that both safety nets are bringing in order to be able to create health for Broward County. That is transformational. By using those expertise, one of the things that we are going to be doing is that we are going to strengthen maternal health. We are going to be eliminating food insecurity. We are going to expand primary care. And in order to be able to do those things, the resources that we are placing together, the millions of dollars that's going to come together to be able to make this possible, come from people in this room. All over, yes, it comes from the people in this room. Children's Services, not only United Way, but we have Broward Regional, we have all of you coming together to make a difference. One of the things, the most important thing, is in maternal care. You saw that we opened close to a year ago, we opened a women's center in an area that the women used to drive 40 minutes, like Oshie said, even sometime an hour, taking 2 buses, being pregnant and taking 2 buses to reach to your doctor's appointment. That is one of the reasons why sometimes we miss the first trimester, because it is not the right thing to do. And we at Broward County always do the right thing. Is that not correct? Right? We do the right thing in Broward County, and that is the reason why we are here. One of the things we want to do is to decrease mortality and morbidity among mothers and babies. Do you know that in the industrialized nation around the world, some of them have 0 maternal death, 0. Some of them has 1 digit. The United States has double digit, 22%. And in that 22%, the highest rate is among our Medicaid moms, our underserved community. I know that we cannot have this continue, because everyone that is here that took time to come out here has a heart and a passion for what we're going to be doing. The other thing is this. The adults right now, we have adults that are not receiving primary care. Primary care is the foundation of the building. Primary care is foundation of health. And primary care is not a luxury, because without primary care and health, there's no wealth. So I'm telling all the elected officials, if you want a really thriving city, make sure you have primary care there, because that's the health of your city. So when we create these primary care programs, and not only we're going to create those programs, is that we are going to be able to not only do brick and mortar, but we are going to be using our 2 mobile vans to be able to infiltrate and the word is infiltrate, like we were all undercover, because we want to make sure that people don't even realize that, wow, I can't believe of this change. This is really inspiring. You may say, oh, Melida, Shane, this is pie in the sky. You know what? This is too difficult to accomplish. but I know that in Broward County, the collaborative Broward County, we can do it. We can do it because we are Broward County. Better Together will save lives. It will strengthen the family. It will create a healthier future. But why? Why this difficult endeavor? Why we did not just decide to plant a tree somewhere? It would have been easier, to do a good landscape, but that is not changing life. And we want to change life. So this is not an easy task. We want to be going into the underserved community. We are going to help women in the neighborhood to be able to ensure that they have access. We know that hypertension and diabetes are the #1 killers. #1, diabetes and hypertension in the primary care arena. But do you know that it's also the #1 killer among pregnant women? So what we are doing, both organizations, Broward Health and Memorial, Better Together, is when every pregnant hypertensive woman that walks into the emergency room went to get a blood pressure cuff. And when they get a navigator. A blood pressure cuff and a navigator. And that blood pressure cuff is going to be able for her to take her blood pressure on a daily basis. And when she takes her blood pressure, and the navigator is going to be calling her to double check to make sure that she is okay. I want to share with you a real story, and of someone that I know. This young lady, she had her baby at one of our hospitals at Memorial, and she called and she was enrolled in a navigation program. And she called her navigator and says, my blood pressure is high. I want to just go for sleep. I'm going to sleep it off. And the navigator says, no, I think you should come to the emergency room. And because there was that relationship, she went into the emergency room. Do you know that she ended up in ICU? Do you know that a couple days later, that little beautiful baby girl still had her mom, because if she had gone to sleep, she would have passed. So this program saved lives. We are saying today, nothing pie in the sky. We are saying the reality that what we are going to be doing. We are declaring war on diabetes and hypertension. So you are the soldiers, and we are all soldiers because we are declaring war on diabetes and hypertension. How are we going to do it? How are you going to declare war? You have to have a plan. And our plan is to ensure that not only we're going to build brick and mortar. It's interesting, when for-profit organizations decide where they're going to have a nice clinic or a practice, they look for affluent areas. We are not. We are looking at our emergency room heat map, the areas where people are going to the emergency room in order to achieve primary care. And we are looking at those maps, and we are building, regardless of ability to pay, building primary care. And in those areas where we cannot build brick and mortar, what we are doing is that we are galvanizing our mobile vans, over 4 mobile vans, and Commissioner Justin very soon 5 mobile vans between the two organizations. And we are getting those mobile vans out in those areas. And not only are we going to pass through those areas, because this is not about doing a health fair. This is not a one-day situation. We're going to stay in that community for 2 years to be able to make changes to health. You only can make changes to health if you are consistent and if people trust you. And that is what we want. We want your trust, and we know that every one of you that is here have a span of control, a span of influence, so we want you to use it. One of the beautiful things is that we are going to measure, because we can come up here, or commissioners can come up here our city commissioners can come up here, Shane can come up here and we have a beautiful location and a beautiful everything and good food, and then we can say, you know what? It was a good speech. Are we making changes? Okay, so what we're going to do is use data. We are going to measure every single thing. We are going to measure ED visits. We're going to measure OB navigation visits. We are going to measure every single thing that could be measured, because as we are not perfect, so this is something that we know that can work, but we want to make sure that the data tell us that it works. So we are going to use that data to be able to make changes, to be able to enhance, and to be able to make sure that we are doing the right investment at the right place, at the right site. So we are making this a data-driven endeavor. It's not only a talk or a pie in the sky. It is data-driven. And you may say, what can I do in order to be able to help with this movement? We will be working closely with you. And we will be also not only working closely with you, but we want you to be our eyes and ears. But I do not want to, and I cannot, leave this podium without just saying who was the idea, who gave that idea, and the what if. A lot of you know Shane Strom, some of you don't know him. I know him. I have the privilege of knowing him. And when Shane comes and says, "What's up? What if?" You guys know how, how hyper he is. What if? And I'm like, what if what? What if, we can take care of hunger? What if we open primary care? What if women don't have to worry about an appointment? What if the two organizations work together? What if, and meanwhile he's talking, I'm like, what if? You know what I'm saying? So, and with all of the energy, Mr. Strom, this is the what if. We are here. It happened. It happened. Thank you for your vision. Thank you for your vision. That is vision. And with his vision, with our energy, we can do it. Let me tell you something. Broward County is going to make national news on being one of the most healthiest cities in the United States. So, but I also want to give a shout out to all our partners. Jennifer, thank you. Laureen, thank you. Cindy, thank you. Mayor, former mayor, commissioners, both of you, thank you. Monica, thank you. Kim, thank you. Board of Commissioners, thank you. I said I wasn't going to get emotional, but this is something that is so dear to my heart. And it's something that we have been waiting for such a long time. And it has come to reality. Now, are you going to stand behind us? Are you going to stand better together? If you are, we want you to go outside, and there is a banner, and you're going to stand behind that banner, because standing behind that banner means that you stand behind this initiative. Standing behind that banner means that you're going to use all of your influence for our community to be able to thrive. The Bible says, "My people perish because of the lack of knowledge." We cannot allow Broward County people to perish because they don't know that there is a better together. Thank you, and thank you. And as we look at the future and better together, we know that we are going to be able to achieve all these goals because all of you are going to make these two organizations and all our community-based organization, all our faith-based organization, better together. Thank you so much.
Well, hopefully you're inspired by Melita's passion, Shane's vision, and everyone in this room, the partnership that has brought us all together. At this point, we would invite everyone to step outside for the group photo. We want you to all be a part of it and then be able to share it with all of your stakeholders and constituents. So thank you so much for coming today, and we look forward to working with you on creating a better together.